Welcome to the Sustainable Clinical Medicine Podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hey everyone, thank you so much for listening in. And I wanted to let you know about an offer I have on right now. We are celebrating the Smarter Charting program becoming lifetime access, and we are celebrating summer. So right now until July 6th, 2024, you can use the coupon code HOT SUMMER at the checkout to get our biggest discount for this summer off the programs Charting Champions or Smarter Charting. Thank you so much for listening in. Enjoy the next episode. Hello and welcome everybody. Thank you so much for joining us today. Today we have Dr. Sapna Shah-Haque with us to help us understand how to help us create those sustainable clinical medicine, keeping in mind the things that she has learned along the way. Welcome. I will let you introduce yourself.
Thank you very much for the opportunity. So as you said, my name is Sapna Shah-Haque. I'm an internist here in rural Kansas, and I've been practicing in this area of the world for, since 2013 in one way or another. So I love rural medicine. It's a passion of mine. I love the community and just the people. I mean, I still think that there's respect and autonomy, and it's a partnership between patient and physician.
Nice. I like that. That sounds lovely. Okay, so how did you end up internist and how did you end up rural? Was that a decision from the beginning or what was going on?
No, it was I like the complexity of internal medicine, and I really didn't have a subspecialty that I absolutely loved. I think they're all great, but at the end of the day, I like my sleep, I like my time off, so I didn't want to be married to my career. So that's how I chose general internal medicine, and then how I ended up going rural was really a multitude of things. Number one, I live in a rural state. State of Kansas is pretty rural. It's in the Midwest, maybe about 2 million people. I joke that we have more cows than people. But having said that, you know, uh, one way that the state actually attracts people to rural areas is that you sign a contract with the state. And for every year that you went to medical school and you practice in an underserved area, you get your debt forgiven. So for me, that was a no-brainer given what I wanted to do. And we actually settled in, my family and I actually settled in an area that we love. It's a great place to work, to raise a family, and here we are.
Nice. Now, a lot of people get really worried by kind of seeing their patients outside of the day. Is that something that would come up for you in a rural town?
It can,
Yeah.
but yeah, I think for the most part, people are pretty respectful of when you're not in the office, you're just another person that resides in the community. But also, I think boundaries are important. Like, hey, that's not a great conversation to have now. Call and
Mhm.
make an appointment. So
Okay.
sometimes it takes a little bit of education, but believe it or not, I actually had more issues with that in my hometown of Wichita when I was doing my residency. I went grocery shopping and I had a patient that worked at the store that was following me up and down the aisles.
Mhm.
And I said, this is not an appropriate conversation to have here.
Mhm.
And especially the nature of the conversation.
Mhm.
Um, 45 minutes. I just pretty much walked around and ignored this, but uh, I had more trouble in a larger city.
That's very interesting, isn't it?
Mm.
I really don't mind assimilating with my community because I'm also rural. But it still surprises me a little bit when patients want to show me something underneath clothing when I'm in Walmart or the store. It doesn't happen very often, very rare. Like you say, I think boundaries are something you teach perhaps and maintain yourself. And most of the time there's that level of respect that, I'm not in the office right now. Um, and then occasionally you'll get a couple of things.
Yeah, and that's like far and few in between. And a lot of it's just, being being respectful and but firm and maintaining those boundaries. Like, yeah, we're not having this conversation here, and getting going about your business. And we'll see what the future holds. But I mean, for the most part, it's either that, or if they get upset, then we're not a good fit, obviously.
Hmm.
And I'm
Hmm.
a, it's probably better that way.
Got it. What about in the consultation room? What are the ways people engage with you? Are you always called by your doctor title, or how does that work?
For the most part, yes, because when I'm in the office, it's Dr. Shaw, Dr. Shah-Haque, whatever they prefer. I go by both. But there's some that, because of the rural community, I have friends that are patients and patients that are friends. And so there are some that call me by my first name, but it's because I've given them permission, right?
Hmm.
We have that equal understanding. I can't say enough good things about the level of respect, and but respect goes both ways. So I can't say enough good things about where I'm at.
Hmm. That's really lovely to hear. You said that you like your sleep and you like not being on call all the time. Tell me the reasons how that came about. How did you know this about yourself?
Sure. I when I am working during the week, that's fine. I do outpatient medicine only. But there was a stint between 2013 and 2016 where I did the traditional inpatient, outpatient consultations, inpatient and outpatient, along with my patient panel. And for me, that was too much. And I don't think it was because I was I was weak. I think it was because literally it was an unsustainable model. And this was before we had a hospice program. So because I was like one of three internists in the small town, I'd get called for consultations on holidays or weekends when I was actually off. And then we had a call group that was a mix of family medicine and internal medicine. And if the patient was too complicated, well, I was expected to stay on as a consultant. And it's more like, I need my time off. I need my time with my family. I need my time to recharge. So it really became a system where I was working 7 days a week a lot of times. And well, I love medicine. I mean, I love my family more. So for me, that was not sustainable. That's really when I started hitting the brick wall.
Mm. What did brick wall look like for you?
Oh, the brick wall was, I really hated medicine at that time. I hated it. I was ready to leave and go become a bartender, just leave it completely. And then try to figure out the rest. And the listener might think that, gosh, what a waste of time, what a waste of talent, what a waste of education. But the truth of the matter is, I didn't care. I just knew I didn't like what I was doing. I hated it to the point of when I woke up in the morning, it was, damn it, I have to go do this again. I don't like this. I don't want to go to the office. I don't want to see patients in the hospital. I don't want to see patients in the office. I don't want to answer questions. I hate the chart. I really would wish I could run over the computer with my SUV. But it was an echo of just working all the time. And a lot of that was self-imposed because I was trying to build a practice. And, well, doctor, this is what you signed up for. Mm. While it is, this is not the amount that I signed up for, because I think there's a difference between like how medicine is practiced, and then how what we expect it to be, compared to what we're taught. So I don't mind working hard, but I mean, at least in residency, there was still some protected time.
Mhm.
Uh, whereas this was insane. I would get up at 5, be at the hospital between 6 and 6:30, and be coming home at 8 p.m. and still have to chart.
Wow.
Yeah. So I mean, that was 5 days a week. And
Mhm.
then if I was on call, or again, if a family doc was on call that weekend, and there was a complex patient, a lot of times the ICU patients would become mine. I was expected to stay on. And again, I'm all for patient care, but I didn't really look at taking care of myself. So that's when I really felt like, okay, yeah, there's no way I'm gonna look at doing a fellowship after doing my 4 years of service to pay back medical school, because to me it's just not worth it. Why? You can either do further training and get paid less, which makes no sense, or do further training to work more.
Mm.
And I was already saturated.
Yeah, yeah. Was anybody kind of poking you saying, "Hey, you're working too hard. Hey, you don't look so good. Like, what's going on?"
Uh, my family,
Mhm.
immediate and extended, they were telling me that I look pretty sleep deprived and I was pretty irritable. I mean, I would come home, and instead of talking to my husband and my dogs, I would just isolate for 30 minutes to an hour just to be able to quiet my mind. I was not sleeping because I didn't want to miss a page.
Mm.
Or what's the point of going to sleep if I'm going to be woken up in an hour?
Mm.
And that's just the way the night's going to be. And so there was anxiety, I guess, about missing something, not performing to my best. And you can't operate on that.
Yeah, yeah. Okay. How long did you stay in that place of busyness before and how did you get out of it?
Great question. Uh, like most type A personalities, life happened. Life happened, and when I say life happened, I mean it was a big change in family structure. My mom ended up having a really massive stroke in spring of 2016, and left her with the inability to read and write. She had some left side neglect. She needed care 24/7. So that became my priority and my focus. I really needed to cut back, and though we were only 50 miles away from my hometown where she lived, I felt like I needed to be there. And so life happened, and I decided to restructure. I took another position in my hometown of Wichita, Kansas, where my mom was residing, in order to be more hands-on. And so that new position was outpatient only, primary care at the VA. And so it's Monday through Friday, 8 to 4:30, no call. So it was a godsend. It was a breath
Mm.
of fresh air because of the structure, and because the no call was really nice, and the no weekends was really nice. And
Yeah.
outpatient only, I love the outpatient world.
It's certainly a difference from what you had been experiencing. Did work follow you home when you were working in the VA? Because if you had like family priorities to be consumed by outside
Mhm.
of working hours, I'm just curious if that made a change to how you did your daytime hours.
I had a really efficient team. I had an excellent team, so I was able to delegate things pretty well, and I was able to utilize templates, and really mastered the system. So I think the 4 years that I was there, I think I went home late a handful of times.
Mm. Tell me what the team did for you, because when people say I had a good team, um, we may not be able to imagine what that actually means. So what were you getting them to do that was something you might have been doing yourself before, or what were you doing with the team?
Luckily, it was not just a warm body, right? So right now it's it's hard to find good clinicians, it's hard to find excellent nurses, LPNs, medical assistants. I mean, it's few and far in between. Um, I don't know if it's a lack of critical thinking or if it's generational thing, but they were well seasoned and we knew each other's weak points and strong points. So we would huddle in the morning. Okay, this is what the day's going to look like. This person's going to need this. This person's going to need this. What do you got for me? Okay. Before before we start seeing patients, we're going to start with some of the urgent items for the day, and then here's another about noon. We would do the same about 1:30 and then about 4. So
Mm.
kind of using those times in that structure
Mm-hmm.
to optimize and try to be efficient and help with flow. The second thing was if somebody came in for a blood pressure check, uh, I knew that the LPN or the RN doing that blood pressure check were meticulous as to what they were doing.
Mm-hmm.
And then once I developed a good level of trust with them, it's like, hey, look, when you're checking on the patient, if you think they need an EKG because either their pulse is irregular or it's bradycardic, and you can look back and see that that's not normally where they run because you know these patients as well as I do, if not more, because you've been here longer with these same
Mm-hmm.
patients. Get an EKG.
Mm-hmm.
So also giving them freedom to use their expertise and their knowledge. So there was a lot of delegating, and I'm not going to say freedom to do whatever you want, but because there was a level of trust, hey, use your best judgment. Better to
Mm-hmm.
ask for forgiveness than permission for something like that.
Yep. Yep. What about things like in basket? Were you calling patients with results? Were they able to get in quickly? Did the nurses call for you? What was that sort of makeup looking like?
I don't call patients
Mm-hmm.
unless it's dire
Mm-hmm.
or unless it was a scheduled telehealth.
Mm-hmm.
Because once the patient has you on the phone, it's a visit. And I mean that's 15, 20 minutes you may not get back, you can't bill for it, and I don't like giving away services for free.
Mm-hmm.
But I would send a task to the nurse or the RN or the LPN to as to what the results were. If they were normal, I would delegate it to the LPN. If it was abnormal, moderately like osteoarthritic changes on an X-ray, I would delegate that to the RN,
Mm-hmm.
and they could decide how they wanted to communicate, whether it was a phone call or a letter.
Mm-hmm.
So they had the freedom to choose, and it did come down to what was feasible for that day.
Yeah. Yeah. Okay, good. Okay, so we're using team and we're thinking about how we're using team, what their skill set is, what they're good at, what you trust them to do, how well they're engaging with your patient panel so that you're trusting what they're doing and they have good ideas on their boundaries too. That
Yes,
sounds of it.
yes. Those are
Perfect.
very clear. Those are very clear. And if there were any questions, we were in the same room.
Yeah.
That's just the way the clinic was designed at that spot. Um, hey doc, what do you think about this? Or hey, can you clarify this?
Mm-hmm.
Sure.
Yeah. Now, when you're in that room, sometimes it can be difficult to do your high level thinking. Were they busy enough so they weren't asking questions that often, or your brain lets you do both? How does that happen?
It depended on what it was. I mean, these two were phenomenal. They really were very seasoned. I mean, about 20 plus years each. So I was spoiled. Um, Having said that, if I needed to think critically on something, I can tune out the background noise.
Mhm.
And if they were getting loud or what have you, I could just walk around or go
Mhm.
into to the desk right beside and right outside the pod.
Hmm.
So that was very rare. That was very rare.
Okay, nice. Okay, so we had good working hours, we had the day's work able to get done within the day, and we had a team that being used to their highest level. Great. Okay, so you were there for 4 years. You said, what happened next?
Yeah, with two kids, did not want to raise him in that city. The crime rate had there was an uptick in crime. Just
Mm,
crazy things that didn't happen 20 years before, right? Everybody says that. And I wanted to cut back more,
mhm,
to spend more time with the kids as they were a year and a half and a newborn.
mm,
So I wanted to go part-time. But also part of that was I lost my best friend who was also a physician, lost her to suicide.
mm,
And it really made me stop and think is what the hell am I doing?
mm,
You know, I started to enjoy medicine again. I did enjoy medicine again. And then I'm not going to say the rug was ripped out from underneath me, but it made me think, what are we doing working so much
mhm.
when there are things that are greater than a career or outside of ourselves? And I had two of them that were needing to become a bigger priority. And so I my husband and I and the two kids, we moved back to Winfield is where we're at now. And I work 3 days a week with rotating Fridays,
Mhm.
outpatient only because now I'm in the same place where I was initially. There's a hospitalist system, and that's just
Mhm.
because it's sustainable. I mean, asking physicians to do inpatient, outpatient, and everything else in between is just not sustainable in today's reimbursement and today's model of medicine.
Got it. Okay, so they're doing a hospitalist model. What does a hospitalist model look like compared to you looking after all of your people and they're looking after all of their people? What does the new system look like?
The new system looks like there are dedicated hospitalists within the hospital setting, and if a patient is admitted, they do all the admission, and then I see them for follow-up as
Mhm.
in clinic. So I do clinic only, and for me, I love it. I
Mhm.
That's where my heart is.
Mm, nice. Do they work like on rotation with each other or they're all
Ah,
working?
no, they're on rotation with each other. So um, we have what is called RPG, Rural Physicians Group. So they have different physicians, let's say between 3 and 7 days on in
Mhm.
the hospital 24/7. It's a lot.
Yeah. Okay. So you're gonna need enough volume to be able to cover that 24 hours then.
Yeah.
Yeah, got it. Okay, perfect. And then when you're in the clinic environment, how have you set up those days? Because I hear physicians say, I work 3 days a week, but actually it's more like five. It's just that they're rostered for patients for 3 days a week. So tell us about you now and your days off.
Yeah, so before the recording was sharing with you how today spent outside with the kids because it's summer break. And I'd like to say that that's always the case on my days off, but it's a mix. It's a mix.
Mhm,
So I work Tuesday, Wednesday, Thursday. I'm rotating Fridays. What that looks like is maximizing my schedule to, I'm not talking about double, triple booking patients. I'm talking about getting patients in, seeing them, uh, going over lab scripts, imaging, and the notes. Typically, that's done within that day.
mhm,
Again, delegating to staff what can be delegated, and then what needs to be uh, dealt with by the physician. That's me. I'm going to do that. Whatever needs to be done today, I do before I leave the office, and then whatever can be done or left for the next day within reason, I do that. So a lot of it is just time management.
mhm.
And then do I take home some work? Yes. Did I spend time on the computer today going through tasks? Yes.
Mm-hmm.
Is that every day? No, that's actually not the majority of my time.
Mm-hmm.
When I'm off, unless it is urgent, they can call me. But other than that, I'm not tied to my computer. I'm usually tied up with my kids.
Sounds good. What about like true time off, like the ability to go off grid for a period of time? Is that possible within the model right now that you're in?
Hell yes. Well, yes, absolutely. Um, it's funny that you mentioned that because we did that last summer and we got stuck because things happen. But I mean, that's the thing. That's the thing. I have an outpatient clinic that I work with another physician and three nurse practitioners. They're wonderful. When I got stuck in New Mexico, I had no way of getting back. The
Hmm.
brakes on the truck went kaput. And of course, it was on a holiday weekend and everything was rented out. So we were we were stuck there for 7 days. And patients had to be rescheduled. Urgent things were dealt with by my partners. And so hopefully, I mean, it's always ideal to plan it, but that was beyond our control. So
Mm.
heck yeah, it's doable. I love it. And for me, because when I'm off and I have great people to cover and we do the same for each other, right?
Mm.
So that's what makes it sustainable for me.
Yeah, love it. Okay, good lessons here. Good boundary lessons and good use of your colleagues and use of your team. Loving this. All right. Now, you doing some other things as well? So tell us your other things that are on that you
Yeah,
do.
the other things that I do on my days off. This is the other part that consumes my time by choice. I have a podcast that I started in 2021 called The Worthy Physician, and it was during the pandemic that it was started and going through burnout and moral injury myself and then losing Dr. Bicker to suicide. And then, after her suicide, I started reading about why the rate of physician suicide.
Mm.
And I was appalled.
Mm.
Why weren't we talking about it? Why weren't we
Mm.
talking about it? Why weren't we discussing this? Why didn't we know this in medical school?
Mm.
Why didn't we discuss this in residency? Um, it's heartbreaking. And I didn't know what to do with that grief.
Mm.
I I carried around the idea for 18 months. And 6 months prior to starting the Worthy Physician, I actually I went to therapy
Mm.
because of your anniversary was coming around and I did not know how to process those feelings.
Mm.
Um, just there was a lot to unpack there. There was a lot to unpack, not just on a I mean on a personal level, on a professional level. So that's when the Worthy Physician was born, because we're all worthy, even though we are supposed to sacrifice everything for the patient. No, no, we're worthy of having that same love. We're worthy of having that same compassion that we're showing our patients. We need to show that to ourselves.
Mm. I love this. So important.
Yeah.
Yeah. When you were working through some of that grief, what did self-compassion look like? What were some of the things that you were doing that would help you?
Therapy was a big one.
Hmm.
Therapy and a life coach.
Hmm.
Therapy and a life coach, both.
Hmm.
That meant at least 1 to 2 hours a week.
Hmm.
And for me, I went to a therapist and life coach in another city in Wichita, 45 minutes from where I live now. Um, and I referenced that earlier because I had my family was there, my mom. For me, that was self-compassion
Hmm.
because I was saying, "Hey, I need help. trying to process these feelings, these things inside me that I don't know how to label. I don't know what it is. I just know I have to get this out.
Mm.
Uh, I asked for help. For me, that was showing my self-compassion. That freed me up to feel a lot of things that I needed to. Um, it provoked my own thoughts and reflection on my past as a physician. Um, but I think the coolest part was it's an hour drive each way. So I had 2 hours of unprotected time without kids, without anybody else. And so that was a reset. I always looked forward to that because of the drive.
Mm. I like that. It was almost intentional peace and quiet and therapy.
Oh, it was yeah. And so yeah, my husband would be covering for me with the kids, and then, I would do the same for him when he needed to go someplace. But it was teamwork. It was a group
Mm.
effort, and it was beautiful because of the serenity. It was so
Mm.
nice just to not have background noise or somebody screaming. I think quiet is something that I really needed at that point in time.
Mm. Notice when you were really, really busy in the hospitalist and the clinic situation, peace and quiet was something that you craved then too.
It was, especially from, 2013 to 2016, but I wish I knew then what I know now about boundaries, and I think I would have been much better, but you live and learn, and I'm
Mm.
glad I learned from it.
Yeah, yeah. And even started making decisions with your needs in mind now.
Yes. Yes. And it's an unfortunate situation that happened, but uh I'm glad I was smart enough to step up to the plate and use that opportunity to pivot and make those times count because uh I can definitely say that I don't regret it. I don't regret it. I don't regret the time I spent with my mom.
Mm. Yeah, so important. Um, what about the fear of consequences by going to therapy?
What consequences?
Just so we get that feedback that if I acknowledge that I need help, does that
Hmm.
mean that I'm broken so I can't do my job? Will I get reported? Will I have to talk to somebody else about it because I've gone to therapy?
Great question. And I would say that Dr. Bickard died in her office in June of 2019. By October 31st, 2019, same year, they had changed the questions um, for medical licensing here in the state of Kansas. So instead of do you have anxiety, do you have depression, they changed it to do you have X, Y, and Z, and does it impede your ability to practice medicine? And no, my question, my answer would still be, yeah, I went to therapy because I needed help
Hmm.
grieving, and it's the damn number, like first line therapy, excuse my language. But it's first line therapy. How dare they say that we can't have first line therapy? Uh I wasn't seeking pharmacotherapy. I wasn't seeking anything that would impede my ability to make judgment, medical judgment. I was trying to figure out how in the hell do I honor my friend's passing?
Mm.
Unnatural, oh, I don't want to say unnatural passing, untimely, untimely,
Mm. Hmm.
right? It's so complicated.
Yeah.
And so I think to not ask for help, I would have done more harm than asking for help.
Hmm.
So here in the US, there are quite a few states that have either done away with or really reframed the questions.
Hmm.
So it's more of does it impede your ability, or they've done away with the questions altogether. And I know that the Lorna Breen Foundation is working very hard. Grassroots movement, love it. Um, to to get those questions changed because we're human beings.
Yeah. Yeah. And we're exposed to so much human interaction. How
Yeah,
can we not be influenced by others?
yeah.
And we're doing long shifts or sleep deprivation, like you said. How can that not have an impact on us?
To say that it doesn't is ridiculous because we know that chronic stress, we know that sleep deprivation. What do we tell our patients, for crying out loud? Pretty much eat well, sleep well, and moderate your stress, right? But yet we're in a system where they expect us to do the same, and then we're chastised if we say no. And you know what? I can't make everybody happy, but I can make myself happy. And I can go to sleep at night knowing that what the patients that I took care of today, I made decent decisions with their input. So it's shared decision making. Doesn't change my advice, but it's shared decision making.
Mhm.
And I didn't do it with sleep deprivation from work. I didn't do it because of I've been up for 48 hours because I'm trying to prove to somebody. I mean, that's where patients get harmed.
Mm. Yeah. Very good. I'm so pleased to hear that the necessary pieces that you needed were available to you and were not having any negative consequence, which is super important. And to hear that that is spreading is even better.
Yeah. Yeah. It's you know, there's hope, and that's what gives me hope.
Mm.
If I look, where I was, I think 5 years ago, not necessarily just in a personal state, and we weren't having these conversations. But now we are, and I think that's really important to, and that's what drives me as far as boundaries, as far as, okay, this is what I need, this is my core values, my family, my needs are what I base my decisions on. And that's where I base on what I will and won't do. And if somebody says, well, your generation just doesn't like to work anymore, it's not that. Uh, I think we just have it figured out a little bit better. But then again, we're in a different era of medicine than what they were 30, 40 years ago. It's changed so much.
Mm.
So
Yeah, totally. Where do people find you if they're interested to learn or listen to your podcast?
sure, thanks for asking. Go to theworthyphysician.com, TheWorthPhy.
Yes.
Nice.
Physician.
Physician, yeah.
Perfect. The worthy physician. Love it. Um, if somebody's in that place where they're doing the everythings and they're worn out, they can tell they're not sleeping well, or they're in a place where they're not feeling good. What do you suggest? What are your kind of advice to them?
Hit the pause button. Hit the pause button. What does that mean? Well, it's going to look different for everybody. It doesn't, I'm not saying quit your job. I'm saying really pause, whether take a week off. And I'm not saying that that's going to be the cure, but take some time off, create some white space, go on a drive, go on a cross country road trip, and get stuck somewhere. But the whole point is to quiet the external noise and the external influences. Sit with yourself, by yourself, or with your significant other, your family, your friends, and say, I'm miserable, or I have no idea what I'm doing, but it's not sustainable. Acknowledge what you're feeling and then figure out what you need, and then start sketching out a pathway from where you are to where you need to be. It might be slow, it might be fast, it just depends on where you're at and the other circumstances, specialty, geographical location. But start making that change. And even if it's going non-clinical, even if it's leaving medicine, if it's cutting back, if it's changing your place of employment, do it. And there's never a great time, there's never a right time, but a lot of times when you throw it out to the universe, opportunity presents itself. Sometimes we just have to be open.
Love it. So good. Anything we didn't talk about that you wanted to talk about?
As much as the EHR sucks, as much as some of the bureaucracy does, the system needs to change, but it's if you need to ask for help, you're not broken, you're human. And I really would like to see what the rate of PTSD is in medicine, because I mean, we see a lot, we encounter a lot, we absorb a lot of energy, and you can't tell me that does not leave a lasting scar at some point. So, just acknowledging your humanity is huge.
Yeah. So important. Well, thank you so much, Sapna, for being here with us and helping us on our journey towards figuring out what we need in our journey. So good. Thank you.
Thank you.
Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the Premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.